My presentation is on the effects of the Affordable Care Act. In 2010, former President Barack Obama introduced the Affordable Care Act. It was more commonly known as Obamacare at the time. And he had three goals in mind with this act. The first one was to introduce Americans to access to more affordable health insurance. The second one was to expand Medicaid. And the third one was to support new medical care delivery methods. When the Affordable Care Act was first introduced, it was met with a lot of controversy because when trying to give Americans access to better health insurance, they were pretty much forcing them to get health insurance. If they didn't have it, they could be met with fines. But at the same time, insurance companies were taking the opportunity to increase their premiums since everyone was having to get health insurance. But at the same time, there were a lot of benefits to the Affordable Care Act. So that's what I looked at for this presentation. I looked at two studies. The first one was looking at breast cancer survivors and how access to insurance has affected them. And the second one looked at how Americans have been getting health insurance since the Affordable Care Act was put into place. So the first study looked at how breast cancer survivors were insured from period from 2008 to 2015, so before and after the Affordable Care Act was put into action. And you can see in the graph here that the number of uninsured breast cancer survivors significantly decreased, meaning that they were able to get in their screenings after surviving breast cancer and they were able to stay in remission. The second study looked at how Americans were getting their insurance before and after the Affordable Care Act. So the first graph here shows how Americans were getting insurance from the period from 2009 to 2013, and you can see that just under half of all Americans were getting their insurance through their employer, and at that time there were 42.3 million uninsured Americans. And then after from 2014, not only did Medicaid expand, but also the number of uninsured Americans decreased to 31.3 million. Also, you can see that the employer-based health insurance also decreased. This was due to another con because basically employers said they started laying off people so they wouldn't have to give as many of their employees health insurance, so they didn't have to pay for it. But as you can see from these two graphs, the ultimate goals were reached in giving more Americans health insurance because there were more getting insurance and more getting access to affordable health care through this, which I believe was the real goal of the Affordable Care Act, was to get Americans not only more financially stable with health care, but to also give them better access just to health care. Because another result from the breast cancer study found that women who had abnormal mammograms come back were less likely to go back and get the treatment because they were scared they wouldn't be able to afford it. But now with the Affordable Care Act, these women are able to get insurance and are able, when they get the abnormal mammograms, they're more likely to go back and get the treatment and actually beat breast cancer, rather than these women who aren't able to afford it and spend more time in the hospital, and unfortunately a lot of times they die. And this is true for a lot of Americans. When they get abnormal test results back, they don't want to go back and keep getting treated because they can't pay for it. But if they have health insurance, they're more likely to be able to pay for it. Goes for also just normal primary care checkups. If you're more likely to go to those, then doctors are more likely to actually see problems before they actually become a real problem and are better able to treat it, ultimately keeping Americans healthy, out of hospitals, and ultimately saving lives. So in conclusion, I want to thank Dr. Becker and Elizabeth Hornsey for all the work they put into this class this semester. I really enjoyed it. I also want to thank the medical science major and the University of Cincinnati for all the opportunities I've gotten. Thank you.